Admiral Brett Giroir, former coronavirus White House task force member and former HHS Assistant Secretary for Health. How you doing, sir? Good day to you.
I'm doing great.
CDC says no to the mask. Now the pediatricians group's coming out and saying 2-year-olds have to wear them in the classroom. Is that necessary?
So I still firmly agree with the CDC that if you are fully vaccinated, we know vaccines are highly effective and they're safe. You are protected. If you're fully vaccinated, you should not need to wear a mask. You should feel safe. And I believe that is correct guidance and should continue. In terms of the American Academy of Pediatrics, their report yesterday, one thing they did say that I fully agree with is that it is imperative for all children to get back to school in person. That was in bold in their statement, and I agree with it. Aside from that, that statement was more about social change and social policy, and it was very light on the science. I completely disagree that children over 12 who are vaccinated should wear a mask. And I think there is a strong argument that children under 12 should not wear a mask, or at least that should be part of a debate and not just assumed.
Admiral, I think the confusion for a lot of parents when they have the American Pediatrics, the Academy of Pediatrics making this statement, suggesting such that kids as young as 2 should be wearing masks, and then school-age kids, kindergarten even, should be wearing masks. Why only look at one aspect of this, obviously the spread of the possible virus, but why isn't there any concern about the lost learning, the lost productivity for kids, the lost socialization when they don't see each other's faces? Why isn't that of equal concern? Because these are our kids. This is our future.
I completely agree with you. We know, and there's increasing evidence, that children are at incredibly low risks of death. And it is even arguable that any normal children or significant numbers have died. A new report out of the United Kingdom showed that only 25 people under age 18 died of COVID in the entire last year, and half of those were chronically ill, like on respirators and feeding tubes. So we need to debate that. The AAP even cites the WHO. If we listen to the WHO, that children will be safe. What they cite from the WHO says children under 5 should not wear a mask at all because it's going to inhibit their social development, and you shouldn't do it. And between 6 and 11, only under very specific high-risk circumstances. So even the material that the AAP cites is contrary to their recommendation. Yeah, I can understand why people are confused.
Jerome Adams, former Surgeon General, he worked very closely with him on the task force. He came out with quite a statement this week. Here it is. He said, last year, Tony Fauci and I famously, prematurely, and wrongly advised against masks. I felt it was the best call at the time, but now regret it. Instead of vax it or mask it, the emerging data suggests CDC should be advising to vax it and mask it in areas with upwards arrow cases and positivity, until we see numbers going back down again. CDC was well intended, but the message was misinterpreted, premature, and wrong. Let's fix it. So you've got that out there. Then here was Fauci on Monday of this week. Roll this. This is call for number 3, guys. Watch.
The CDC recommendations may be at variance with that, but in every respect, the CDC always leaves open the flexibility at the part of local agencies, local enterprises, local cities and states to make a judgment call based on the situation on the ground. I think that's a reasonable thing to do.
He talked about flexibilities, recommendations on the ground. With this new Delta variant, what's important about knowing hospitalization rates and death rates about the variant when you've already gotten the vaccine, many of us?
So let me make it clear a few points that everyone needs to understand. If you are fully vaccinated, you are not 100% protected, but you're well over 90 to 95% protected, even against Delta. So it is a good recommendation that if you're fully vaccinated, you do not need to wear a mask. If you are unvaccinated, the Delta variant is very contagious. 60, 70, maybe 100% more contagious than the baseline variants. So if you're unvaccinated, you are susceptible and you need to wear a mask. Very, very important. I do not believe it's important unless you're at an age group over 85 or you have underlying conditions that if you're vaccinated to wear a mask as well. It's certainly your option. My 88-year-old mother, if she's gone in public, she's fully vaccinated. we talk about wearing masks to give her extra protection. But aside from those groups, you should be good.
If you could, in a couple words, because we've got to leave it there, Admiral, where are we in this? We kind of felt like we were living in this almost in a post-pandemic world, and now there's just so many more fears. Where are we with this?
We're at a very, delicate and potentially dangerous point because the Delta variant will spread among those who are unvaccinated. There is no question about that. Our hospitals are in a very different situation. We have treatments, we have PPE, we have lots of hospital capacity. But I do urge people, please get vaccinated. It will protect you against all the variants, and we can put this thing in our history. But we're still in the middle of the fight, and people need to take it seriously.
The middle. Wow. Okay, sir, thank you. Come on back soon, Brett Giroir. Thank you, Admiral. Nice to see you.
Thanks, Admiral.
Thank you.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.